Also next week, we're going to move forward on an appropriating process that's gotten way out of control. I'm glad that the leaders have decided to appoint a special committee to look at this. You and I are on that committee to look at the budgeting process, to look at what's happened here, that instead of bringing these bills to the floor one at a time and letting every member of the Senate have an opportunity to amend every bill in any way they want to, as long as it deals with spending and as long as you don't add new money, every amendment you want to come up with that I'd like to take some money here and spend it here instead and have a debate about why that should happen. That's what the Congress did for a couple hundred years, and it's time we did it again. This idea that all the bills come together in one big, what we call an omnibus, ominous might be a better word, but an omnibus spending bill that includes everything plus all the legislation that it can possibly carry is not the way this process should work. Now, it's the way this process is going to have to work this year because we missed all of those opportunities that are now behind us. As soon as we get this done, Mr. President, we need to start on this year's process, and we know what the top line spending number is going to be, and there's every reason to believe that this year's process could be a big step in the right direction, but some guidelines from that special House and Senate committee will do even more. I would like to say, as the chairman of one of those appropriating committees, the chairman of the Labor and Health and Human Services and Education Subcommittee, that one bill of the 11 left after the defense bill is decided on, that one bill has about a third of all the money to be appropriated of the discretionary money. Senator Murray, my counterpart on the other side, and I have worked hard on this committee for 3 years now. In the House, Chairman Cole and Congresswoman DeLaura, who chair and the ranking member on that side. These are big decisions to be made. These programs matter, but some of them matter more than others. And part of our job should be and needs to be setting priorities, doing things that increase the commitment to the programs that are working and eliminate the programs or change the programs that don't work. And hopefully we'll continue to do more of that this year and even more of that next year. Programs that touch the lives of so many Americans, like apprenticeship programs. Medical research clearly touches the lives of virtually every American and every American family. What we could do to develop a flu vaccine that actually hits the mark every year instead of misses the mark often. Things we can do in special education are all parts of this one part of the bill that Senator Murray and I and Congressman Cole and Congressman DeLaura have been working on. But frankly, Mr. President, everybody should have had a chance to work on this. I think we know a lot about these topics. I think that our debate is a good debate, but it's not nearly as good a debate as if every single senator got to be part of working on this, not just the 3 dozen or fewer senators that are on the Appropriations Committee. There's a wide variety of programs here that need to be funded, and I want to spend just a few minutes talking about some of the priorities that we're looking at that need to be part of this bill and create a sense that this is really a process that matters. You know, first, we're on track to increase the third straight year of significant increases for the National Institute of Health and Health Research. So what do they do? In the last decade, we failed most of the time to make any increase at all. In fact, 2 years ago when I started chairing this committee, and Congressman Cole started chairing the committee on the other side of the building, it had been 12 years since there had been 1 penny increase in health research. And during that 12 years, we'd figured out so much more about the human genome. We'd figured out so many more ways to figure out how I'm different than you and you're different than me, and how that makes a difference in how whatever is attacking my system, we could fight back, and not 1 penny of increase in 12 years. In fact, the research people said that we were 22% below in buying power 3 years ago, in research buying power, where we'd been 12 years earlier. And young researchers who'd never gotten a research grant before weren't likely to get one. when you had less effective money to spend than you'd had for over a decade. So hopefully that 22%, our goal would be to get most of that 22% back in 3 years. We've also already restored 13% of it. I hope we have a big number next week that gets us back to where we're at least back where we were in 2005 or so. We made a commitment at the end of the last century to double in a short period of time National Institute of Health funding, and then somehow we thought we were done. Now, we would be done anytime there's no more research to be done. We would be done as soon as we've developed a cure for cancer and found out what to do about Alzheimer's and determined what we can do to make heart attack risk less, and found the answer to every orphan disease, a disease that only a few people have. But let me tell you, Mr. President, we are a long way from doing that. In the last 3 years, we've tripled the amount of dollars going to Alzheimer's research. And without a cure for Alzheimer's or a way to slow down the onset of Alzheimer's, the projection is by 2050, we'll be spending twice as many tax dollars on Alzheimer's related care and dementia related care as we're spending now to defend the country. Now, if I'd have said we'd spend $1.1 trillion, I don't know about everybody who's listening here, but in my case, it's pretty hard to get a handle on what does that really mean? How much bigger is that than $1.1 billion? Well, $1.1 trillion is twice what we spend to defend the country. Every military base everywhere in the world, every ship, every plane, every paycheck for every soldier, sailor, airman, Marine, person in the National Guard, the Coast Guard, training dollars, that's about $500 and some billion dollars now, approaching $600 billion. We'd be spending twice of that of today's dollars in tax dollars, not what families would spend to try to deal with the tragedy of Alzheimer's, but twice of that in just tax dollars if we don't find something to do. A cure would be great. Just figuring out how you could determine early that in an effective way that you were likely to get Alzheimer's and begin to try to delay the offset of Alzheimer's so it either doesn't affect you at all because some other health concern does, or you get it a few years later. If we could delay onset of Alzheimer's by 5 years on average, that $1.1 trillion of today's dollars in 2050 would be reduced by almost half, by 46%. So knowing how to detect this, some great studies going on that have been funded in better ways in recent years. This is continued. I think what we're looking at in the BRAIN initiative, the cancer, the cancer moonshot, as Vice President Biden referred to it, diabetes, again, these diseases that maybe not very many people get are particularly the diseases that the National Institute of Health needs to be doing research on, because there's not much of an economic driver for a private sector research on a disease that almost nobody has. So a lot of the money that we put into NIH research, we specifically try to put in there without any specific category where we're saying, you take this money and you do what you think needs to be done, and we're going to have oversight to talk about what you did. But a bunch of members of the Senate and House aren't going to try to become the research deciders for the United States of America, and by the way, for the world when you do that. We're also looking in this bill at the crucial fight on the opioid epidemic. The president says it's a crisis, and he's right. It's the #1 cause of accidental death in the country today. It has exceeded car accidents as a cause of death in the country and in Missouri and in many other states. The last 2 funding bills have put almost an additional $1 billion into opioids from where we were just 3 years ago. But Mr. President, you'll remember that in the last continuing resolution, some specific money, about $3 billion more dollars, was given to this cause, and it's the job of our committee and then the Congress to decide how to spend that $3 billion. We need more resources. There's no reason to think that the opioid addiction epidemic leading to heroin and other drugs is slowing down. So we need to do things that improve treatment and prevention efforts. Prevention, obviously, better than treatment, but if prevention fails, better treatment systems than we have now. We need to look for alternative pain medications that aren't addictive. And I will say that in the 1970s and 80s, I'm told that in medical schools, they thought opioids weren't addictive. So we need to be pretty sure when we have an alternative that's not addictive, it really isn't addictive. We need to be thinking of the workforce needs and what happens when people become addicted to pain medicine and their pain doesn't go away, partly because their addiction doesn't go away. And then behavioral health that impacts so many families and so many communities. And if you're going to recover from opioid addiction, you have to have a place to go. And, too many programs and policies say, we'll work with you for 14 days, or a lot of them say we'll work with you for 28 days, 4 weeks. Not many people get this behind them in 28 days. So we're doing that. We're also looking in this bill at ways to support students and parents and teachers. Obviously, a safe environment. What can we do to provide more flexibility to schools to spend the money they currently have from the federal government to create a safer environment? And then what can we do to increase the money available for that? We need to be doing things that prepare people not just for college, but for careers. If you can get a certificate that puts you to work at a job you love quicker than you can get a college degree that maybe doesn't do those two things, we ought to be thinking about whether or not our post-high school dollars are equally available to both college and other kinds of training. And we need to see that people have access to higher education. We're doing that by increasing the funding for the Pell Grant. This is not a loan, doesn't have to be paid back, given specifically based on economic need and performance in school. You have to stay in school, you have to get passing grades. But in many colleges in my state, Missouri, in every single community college, and in several of our four-year schools, if you qualify for the full Pell Grant, that's more than enough to pay tuition, books, fees, and that part of your education is there. Year-round Pell means if you're putting yourself through school or you're returning to school as an adult, if you're the first person in your family to graduate from college, year-round Pell means that if you've got something working, you need to actually stick with it as long as you can, as quickly as you can. You take that summer break, which is always well-intended because Pell for 10 years didn't pay for school in the summer. It does now, started last year. This will be the first year when both students and colleges and universities could really prepare for summer Pell. But if you don't break the rhythm you're in where things are working for you, you're much more likely to graduate from college than you would otherwise be. We need to be sure we prioritize funding for elementary and secondary education grant programs so that they're fair across the country, so that we're not only supporting STEM education, but we're also supporting IDEA for students with learning disabilities. That's all an obligation that the federal government has taken on itself. So we're going to have a chance, Mr. President, next week to deal with this important, long-awaited bill on trafficking. I think there'll probably be one vote that covers more things than it should on funding the government for the year we're already in. But as I've talked about today, there are many reasons for Americans and American families to be focused on the job we do. And frankly, Mr. President, we need to spend our time to figure out how in the future the American people can watch the Congress more closely and watch the Congress openly debate the priorities of the government that the government sets nowhere else quite like it does when it decides how to spend the money that we've been entrusted with. And Mr. President, with that, I would yield the floor and notice the absence of a quorum.
The